Hello everyone, I am Michael Ferrara with Ferrara Services, and today I'll be going over Original Medicare, which is Part A, Part B, and we'll also go over your options such as adding a Medicare Supplement Plan or a Medicare Advantage Plan. I understand when you first are coming onto Medicare, it can be very confusing, and with the massive amount of mail and phone calls, it can become overwhelming. I'm here today to hopefully give you a better understanding of what Medicare is and what your options are. I'll go over the pros and cons to having a Medicare Supplement Plan versus a Medicare Advantage Plan. So let's get started and take a look at Part A. Majority of seniors will be automatically enrolled in Part A and will get their red, white, and blue card in the mail 3 months before their 65th birthday. If you're under 65, you can get Part A if you got Social Security or Railroad Retirement Board disability benefits for 24 months. Or you have end-stage renal disease and meet certain criteria. Part A covers you when you are in the hospital, which we'll go over the cost in a later slide. Now let's go over your initial enrollment period. You have 7 months for your initial enrollment period, which begins 3 months before your 65th birthday, includes your birth month, and ends 3 months after the month you turn 65. If you sign up for Part A during the first 3 months of your initial enrollment period, in most cases your coverage will start on the first day of the month you turn 65. If your birthday is actually on the first of the month, your coverage will actually start the first of the prior month. If you wait till the month you turn 65 or the 3 months after, it will delay your start date. So try and get everything done in those first 3 months before you turn 65. There's also a special enrollment period, which we will not be discussing today, but in short, if you will still be covered under your employer or spouse's employer plan, you'll get a special enrollment period when you will no longer be covered under that plan. So let's take a look at Part B. Part B is for your doctors. This will cover anything that has to do with doctors, such as going to see your doctor for a checkup, anytime a doctor or specialist comes into your room while you're in the hospital. Part B is optional. However, when you receive your red, white, and blue card, Part B will be included. So if you do nothing, you will get Part A and Part B. You can choose not to keep Part B, but you may have to wait to enroll and could pay a penalty for as long as you were eligible to have Part B. If you will be on your employer's plan, you will not need Part B and will be able to enroll in Part B when your employer coverage ends. If you have not received your card in the mail, you'll need to contact Social Security at 1-800-772-1213 and they'll assist you. Most people will pay $134 a month for their Part B premium in 2017. Let's dig into what's covered under Part A. Let's take a look at Part A inpatient hospital cost. What it will cost you if you are admitted into the hospital. With Part A, you'll have a $1,316 deductible per benefit period. This is important to understand. So what is a benefit period? A benefit period starts the day you are admitted as an inpatient in a hospital, and the benefit period ends after you haven't received any inpatient treatment for 60 days. What this means to you is you could end up paying your Part A deductible each time you get admitted into the hospital, which can really start to add up. After your $1,316 deductible, you'll begin paying $329 per day on day 61. If you're still in the hospital on day 91, it will increase to $658 per day. If you're in the hospital on day 151, you're going to be responsible for all the cost. So worst case, you could end up paying your Part A deductible 6 times per year. So let's move on to skilled nursing. With Medicare Part A, skilled nursing will be covered for days 1 through 20 at no cost to you. Days 21 through 100, you will pay $164.50 a day per benefit period, which again starts over after 60 days of no treatment. After 100 days, you're going to be responsible for all the cost. Before we move on to Part B, let's look at what Part A and Part B will not cover. Medicare doesn't cover everything. If you need certain services that aren't covered under Medicare Part A or Part B, you have to pay for them yourselves. So let's look at some of the items and services Medicare doesn't cover, which I'll give you a second here to go ahead and read over some of these coverages here. Now let's move on to look at Part B. Part B will cover anything to do with you seeing or visiting a doctor or specialist. With Part B, you have a $183 deductible per year. Once you meet that deductible, Medicare will pay 80% and you'll pay 20% of any doctor-related cost. This is important to note that when you're admitted into the hospital, each and every time a doctor comes in to visit you, you're going to be responsible for 20% of that cost. Let's take a look at a few things that are fully covered under your Part B benefits. With Part B, you'll have some preventative services covered at no cost to you. So I'll give you a second to look over at a few of these coverages here. As you can see, Medicare Part A and Part B can really start to get expensive. So what options do you have to prevent the high cost of original Medicare? You really have two choices, and that is to go off of Medicare and go with a Medicare Advantage Plan, or supplement Medicare with a Medicare Supplement Plan, also known as a Medigap Plan. Let's take a look at the advantages and disadvantages to going with a Medicare Advantage Plan versus a Medicare Supplement Plan. Advantages to going with a Medicare Advantage Plan include some plans will have a 0 monthly premium, so you'll not have a monthly premium. Part D will be included with most plans, and most plans you'll get a free gym membership through Silver Sneakers. So what are the disadvantages? With your Medicare Advantage Plan, you'll have copays when you go to use them. High out-of-pocket expenses. The more you use these plans, the more it's going to cost you. You will have a max out-of-pocket which ranges anywhere from $2,900 a year up to the max, which is set by the federal government, of $6,700 a year, plus all your co-insurance, which can go well beyond your max out-of-pocket. You'll be tied to using the plan's network of hospitals and doctors. These plans are affected by the healthcare reform. You are locked into these plans for 1 year. Doctors and hospitals come and go off these networks throughout the year, which could leave you looking for a new hospital or doctor. Medicare is no longer your insurance company, which puts your healthcare in the hands of the carrier and not your doctor. This is very important. If your doctor sends you to surgery that he feels is in your best interest and the carrier thinks the surgery is unnecessary, if you go ahead with that surgery, you could be paying that bill out of your own pocket. Medicare pays the insurance company to manage your health care, which could be a few hundred or more a month. We don't know how much Medicare pays these insurance carriers to manage your plans. Medicare Advantage plans may look and sound really good. However, when you go to use these plans, they can get very costly and very nasty. Now let's take a look at Medicare Supplement Plans. With your Medicare Supplement Plans, we could just flip the advantage and disadvantages right around from the Medicare Advantage plans. The disadvantages to having a Medicare Supplement Plan versus a Medicare Advantage Plan is you're going to have a monthly premium. Your Part D is not going to be included, and with most your Medicare Supplement Plans except for 1 or 2, Silver Sneakers will not be included. So what's the advantages? You'll not have to worry about copays. No high out-of-pocket expenses, no co-insurance, no network restrictions. As long as the doctor or hospitals accept Medicare, your Medicare Supplement Plan will follow. You don't have to worry about what's going on with the healthcare reform. You're not locked into these plans. In fact, you can switch every month if you so choose to. All plans are regulated and standardized by the federal government, and most importantly, Medicare is your insurance company. This is important simply because Medicare knows nothing about health coverage. Therefore, your health care is up to your doctor and not a plan. Unlike with Medicare Advantage plans, if your doctor sends you to surgery because he feels it is in your best interest, then Medicare pays, and your supplement plan picks up where Medicare doesn't. So let's take a deeper look at Medicare supplement plans. Medicare supplement plans, as mentioned earlier, are all identical and are standardized by the federal government, which means whatever Medicare supplement plan you choose, it's not Blue Cross Blue Shield, Mutual of Omaha, Equitable, AARP, Bob's Insurance, etc. It's Medicare's plans, which private insurance is allowed to offer to you. Please note that all plans are offered by not all plans are going to be offered by each insurance carrier. Each carrier can choose which Medicare supplement plan they want to offer to you. There are currently 10 different Medicare supplement plans, which can be found on page 82 of your 2017 Medicare and You Handbook. Plans are A, B, C, D, F, G, K, L, M, and N. When shopping for Medicare supplement plans, it is important to note that all the plans are the same, and the only difference is what each carrier charges you for that plan. So let's take a look at these plans. Here are all 10 Medicare supplement plans. As mentioned before, not all these plans will be offered by all private insurance carriers. This chart will show you what each plan covers and does not cover. When you're shopping around for a Medicare supplement plan, always remember that the plan you see here are the ones each carrier is able to offer to you if they choose to offer that plan. Plan G, for example, is the same Plan G with Blue Cross and Blue Shield, Mutual of Omaha, AARP, Equitable, and so forth and so on. The only difference is what each carrier chooses to charge for that plan. Now, some companies will be rated better than others. However, by law, if they offer the plan, it has to pay according to this chart you see here. Now let's take a look at how supplement plans work. Now, let's say you're admitted into the hospital. We know that you have a Part A deductible of $1,316 per benefit period. Looking at the two most popular Medicare supplement plans, which is Plan F and Plan G, as you can see, your Part A deductible is covered at 100%, so you pay nothing. Now let's look at your Part A coinsurance. Days 1 through 60, you pay nothing. Days 61 through 90, you pay $329 a day, which if you're there 90 days, you will pay $9,541 with original Medicare. With your Medicare Supplement Plan F or Plan G, you pay nothing. That cost is covered at 100%. Days 91 through 150 is your lifetime reserve, which you only get once. And as you can see, it'll cost you $658 a day for a total cost of $38,822, which you would be responsible for under Original Medicare, which is Part A. With your Medicare Supplement Plan F or Plan G, you again will pay nothing. It's covered at 100%. Your Medicare Supplement Plan will also provide you with an additional 365 days of coverage that Original Medicare doesn't offer. Let's now look at Part B costs and how we're going to pay those doctors. Part B, you have a $183 a year one-time deductible for 2017. With Plan F, your Part B deductible will be paid for you, which is why you'll pay what I like to call a convenience fee for them to pay it for you. With Plan G, you actually save money by paying the Part B deductible yourself. With Plan F, your Part B deductible is paid whether you use it or not. After your Part B deductible is met, we're going to take a look at Part B coinsurance. With Part B, Medicare pays 80% of the bill, and you will pay the other 20% with no out-of-pocket max, meaning it can go as high as it can go. With your Medicare Supplement Plan, Plan F and Plan G, you're going to pay nothing. It's covered at 100%. So as we can see here, supplementing Original Medicare with a Medicare Supplement Plan will prevent that high out-of-pocket unknown that can come with Original Medicare or even a Medicare Advantage Plan. I really appreciate you spending a little time with me today to go over Medicare and your Medicare options. Hopefully you found this information useful and have a little bit of a better understanding of what your options are when it comes to your Medicare benefits. I understand it can be very confusing when first coming onto Medicare. If I can help answer any questions, or if you're ready to enroll in a Medicare Supplement Plan, give my office a call and I'll be honored to help in any way that I can. Again, my name is Michael Ferrara, and I can be reached at 815-254-0340, or you can email me at any time. But thank you for watching, and I hope you have a great night. Bye-bye for now.